remote ischemic conditioning is a physical strategy that can be applied on arms and by cuffs on arms, and which was initiated by several cycles of brief ischemia in arms, and it can protect against subsequent prolonged ischemia in distant organs, or reduce the ischemic injuries in distant organs. And this strategy has been investigated in the field of stroke, acute cardio infarction, and the field of renal protection. And previous study has found that remote ischemic conditioning can protect the heart, the brain, and the kidney. And in my previous studies, and we have determined that remote ischemic conditioning can prevent the recurrent ischemic stroke in patients with symptomatic intracerebral intracranial artery stenosis. And in animals, in our previous study, we found that remote ischemic conditioning can accelerate the hematoma absorption in animal mode of intracerebral hemorrhage, and accelerate the neurological recovery. And in our pilot clinical trial, the RICH-1 trial, we found that this strategy, remote ischemic conditioning, can be safely performed in these part of patients. And we all know that intracerebral hemorrhage is the least treatable type of stroke, and we have no effective therapies for patients who didn't receive the surgical therapy. So in these part of patients, we want to detect whether remote ischemic conditioning can perform as a neuroprotective strategies to accelerate the hematoma absorption and improve the functional outcome in these part of patients. The RICH-2 trial was performed in 20 comprehensive stroke centers in China, and we enrolled 459 patients during from 2021 and to 2023, and during the 3 years of study, and we enrolled 459 patients, and all the patients were didn't undergo surgical therapy, and all of them were supratentorial intracerebral hemorrhage, and the years of these patients between 18 to 80 years old with an NIH stroke scale between 6 to 20 points. And for patients with intracerebral hemorrhage secondary to other reasons such as the tumor, the traumatic injury, and were excluded. And patients with supercharged intracerebral hemorrhage, supercharged hemorrhage or intraventricular hemorrhage were also excluded. The main findings of this clinical trial was the 90 days MS, the 90 days functional outcome. The functional independence was not significantly different between the two groups, and the personal functional independence was 68.1% in the RICH group and 72.1% in the sham group. And other clinical outcome, including the excellent outcome evaluated by the MS score of 0 to 1, and the good outcome evaluated by MS score of 0 to 3, also showed no significant difference between two groups. And we also detected the stroke scale within 7 days, and the result also showed no significant difference. And the safety outcome, including the incidence of death and neurological deterioration, and the early improvements also showed, and the serious adverse events also showed no significant difference. The findings of the RICH-2 trial is not as what we have expected, and we think that the neutral result of the RICH trial mainly attributed to the mild severity ICH of all these included patients, and the baseline and the baseline of the enrolled patients, including the NIH stroke scale, is about 10 to 11 points, and the hematoma volume is the baseline hematoma volume is about 11 to 13 ml. So the neutral result of the trial may be mainly attributed to the mild severity of stroke, because most of these patients can achieve a good functional prognosis, and we also can't exclude the reasons that the RIC protocols investigated in these patients it is just used for 7 days and once delay, and with other RIC protocols such as remote ischemic conditioning for 2 weeks or for twice delay, and maybe need further investigations. Although the RICH-2 trial didn't show the efficacy of remote ischemic conditioning in patients with intracerebral hemorrhage, and this is the first multi-center clinical trial performed in the field of intracerebral hemorrhage, and it did determine that in these patients, remote ischemic conditioning can be safely performed, and maybe in the future we need to investigate whether remote ischemic conditioning can benefit the patients with much larger hematoma size or much severe intracerebral hemorrhage, and also it may be investigated in patients who underwent who were treated with surgical therapies, and combined with remote ischemic conditioning, it maybe can further improve the prognosis for these patients.